How can I reduce chronic bronchitis coughing to avoid social embarrassment? Imagine trying to enjoy a quiet dinner or a meeting when suddenly a cough takes over. Chronic bronchitis, a type of chronic obstructive pulmonary disease, often causes this persistent cough. It happens because of inflammation and excess mucus in the airways. If you want to feel more confident in social settings, there are clear steps you can take. First, quitting smoking is the most effective way to improve your lung health. Smoking damages the airways and makes mucus production worse. Stopping smoking can reduce coughing over time and help your lungs heal. Also, avoid exposure to lung irritants like secondhand smoke, air pollution, dust, and chemical fumes. These can trigger coughing fits and worsen symptoms. Wearing a mask or scarf in cold weather can help prevent sudden cough triggers caused by cold air. Staying well hydrated is another simple but powerful step. Drinking plenty of fluids, like water or herbal teas, helps thin mucus. Thinner mucus is easier to clear from your airways, which can lessen coughing episodes. Using a humidifier at home or inhaling steam from a bowl of hot water can also loosen mucus and soothe irritated airways. This can make coughing less frequent and less intense. Medications play a role in managing symptoms. Bronchodilators relax and open your airways, making breathing easier and reducing cough. Inhaled corticosteroids help decrease airway inflammation and mucus production. If mucus is thick, mucolytic agents may be prescribed to thin it out. Always follow your doctor's advice about medication use. If you notice your cough worsening due to a bacterial infection, antibiotics might be necessary. Pulmonary rehabilitation programs can also help. These include breathing exercises, physical activity, and education about lung health. They improve your overall lung function and can help you control coughing better. Simple techniques like controlled coughing or breathing exercises can be practiced daily to reduce coughing spells in social situations. Avoiding environmental triggers is key. Cover your mouth and nose with a scarf or face mask in cold or polluted air. This prevents sudden cough triggers and keeps your airways calmer. Gargling with salt water can soothe your throat if it becomes irritated from coughing. At night, using over-the-counter cough suppressants can help you sleep better and reduce coughing during social outings. In summary, quitting smoking, avoiding irritants, staying hydrated, using humidified air, taking prescribed medications, and managing triggers all work together. These steps can lessen mucus buildup and airway inflammation, helping you cough less often and less forcefully. That way, you can feel more comfortable and confident in social settings, avoiding embarrassment and enjoying your time with others.